Okay.
Once again, this is 365 N.E.F. Health Talk. This platform right here, we speak about health issues that we believe plague the community, issues that plague our community. Tonight, we're speaking on sickle cell. This is a platform to where I allow people to come and be advocates for themselves, speak up for themselves. When you're dealing with any kind of chronic illness, it's important for you to learn how to advocate for yourself, dealing with doctors, nurses, etc. But today we have a great friend of mine, Candace. I want to tell you great congratulations on your achievements. So
thank you.
tell people what those achievements are that you just graduated with your.
So back in September, I graduated from nursing school, and I ended up becoming a nurse. And it was a heck of a journey. I knew it wouldn't be an easy one, but it definitely humbled me a lot more. I was already a humble individual, but it humbled me even more, especially, going through all of this with everything that's going on in this world, with this pandemic and this virus and, all the tragedy, all the sadness that has been going on. I mean, it was something. It was definitely something. And just, trying to push through and, finish college was a lot for me. And, I'm older, so it's a little harder with that too. Not saying it can't be done, but it can be done. But yeah, I've been a nurse for quite a bit now. Just still learning a lot. Now I'm out here in the actual field and I'm learning a lot more than, what I learned in school. It's, going to school and learning something versus graduating and getting out into the field that you are actually, yes, it's totally different. Yeah. Totally different.
You know what? This is why today is important because when I was at not Cincinnati State, Fortis College, and before I graduated, I did a blood drive there. So what I did was I would go to class, give them a little information on sickle cell. But what I wanted to do was link up with the nursing classes that was there on Fortis College. And just which I did, and I spoke to a few people that was about to graduate about sickle cell. And I was just wondering, and I'm asking you too, what does that chapter look like when they speak on? I know they speak on hematology oncology, which is all blood disorders. Mm-hmm. What narrow that down to sickle cell? What does that chapter look like when they?
So with sickle cell, the one thing I've learned from sickle cell with being in college and working in intensive care while I was in school. The main thing that we were actually taught is when a patient has a sickle cell crisis or in a sickle cell crisis, the main things to do is keep them hydrated, keep their pain under control. Mm-hmm. Now, I've known you for years and I've known your situation for years. Mm-hmm. So one thing I've had to, tell other people is that, you learn this, wherever it is you work, you learn that when you're in school, but to actually really break it down, what a lot of people don't know is there's different forms of sickle cell.
Right.
Some people, it's usually hereditary. Uh-huh. It could skip generations. That's something that's not in the textbooks. Mm. You taught me that. You taught me that long time ago. I mean, even then, I was like, oh my God, I didn't know that. It's really bad in kids. That's something else I've learned. Okay. I worked with someone who had children with someone. Both parents carried the traits of sickle cell. They had children, and both of the kids ended up getting it full blown.
Yes.
And that goes down, that breaks down with if two people who have the trait, there's a 50-50 chance that if they have children, their kids are going to have it full throttle. It's crazy how that comes about, but
it's almost like
I witnessed it years ago.
It's almost like the luck of the draw. Like
pretty much.
Because it is
pretty much.
It's it's a shot in the dark. But you said for us in the textbooks, they just really broke down to hydration and medication more or less.
Those were the main two components that they basically threw at us. And I'm like, okay, well, I know it's more than that. Okay, you're telling us, yes, these are the main two components that you do. Okay, maintain their pain, keep them hydrated, pump them with fluids. Okay, fine. You also taught us that, yes, there's different strands of sickle cell. I already knew that. Also, we talked about the hereditary part, how, two people who just have the trait can also have children. And you're right, it is the luck of the draw. Your kids might not have it. Your kids might. Right. To me, I don't feel like it wasn't discussed and it wasn't taught as much as it should have been.
Not thorough. So now question. Now, were they speaking about, did they go into how to treat besides fluids and controlling a medication? What did they touch on about controlling the medication? I mean, controlling the pain episode, if they know how to treat it.
So basically looking at the patient's history, what medications that they're taking, making sure, the dosages are correct, making sure the patient, can, take the dosages that they have been given. Do we give them more, because they're in a hospital, they're in a crisis, let's make sure, let's check their labs, let's check, let's check that. Like there's a lot to be broken down into that.
Right.
They're making sure, if this person has a primary care physician, which I'm pretty sure they do, they're contacting them. They're looking at your medical history. Like, okay, this person is used to getting this many milligrams. Can we go above that? And then we get, the whole medical team involved, especially in intensive care. Everything is just like, it's like the snap of a finger. Everything is so fast. But in situations like that, they pretty much go by your medical history. Okay. It's something that I've observed myself. And in most cases, it takes a while, depending on the situation, depending on the severity of this crisis. Is at least with children. I've never dealt with a patient with sickle cell adult-wise, but with kids I have. Okay. And I can say, it can be different. But there is a lot of blood work involved. That's also something that I've learned. Like when some kids are going through that, they might have to receive units of blood. So I've seen that happen too. And then you have to, worry about if we have enough supplies. Like what if, depending on the patient's blood type. Okay, let's call down to the lab and see like, okay, do you have this type, this blood type of blood in your lab right now? That's something else we have to use as a factor. You don't want to give someone the wrong type of blood either.
Yeah, that's what you don't want to do.
That can cause some serious complications.
Yeah, that's what you don't want to do. And that's why I say, because like I said, we haven't done these in a while. It's something I'm going to start back doing, which is these panels that we used to do. Okay. Right? So what we did was we would catch the graduating class and we will hold a panel maybe at UC somewhere. That's where I normally will be at. And we would just talk to them as patients. It might be like maybe solid 6 of us. And we would speak to them about sickle cell. Because we know, and I know this because it's things that I do, that they don't really go in depth in school about sickle cell. Yeah, they're stressed to pain, which is easily to paint us as addicts, because they force it so much, which it is a painful illness. But with dealing with sickle cell, sometimes you can't see the pain. You can't see the pain. So, which can, get someone stereotyped as seeking because he's not acting a certain way. So we would like to talk to these students, doctors, nurses that's coming out and just really break down to them, judge each patient individually. Because I understand them emergency rooms can jump so busy to the point where you might get 10, 15 sickle cell patients in there. Now you clump them all together, think everybody seeking, and patients fall through the crack for us with treatment. But those are things that that we do for us to panel. And I want to get back to, and this is why me and you doing this, just to go in depth. So what does it look like for a child? Because like you said, you never dealt with an adult with sickle cell for us treating them at this point. But what does that look like as a child? Like, I'm quite sure it's a lot easier because they're not combative. They're not advocating for themselves. More or less, the mama more or less, or the father more or less just sitting there and trusting the doctors and the nurses to treat their child. Like, is it complicated dealing with the parents or the kids?
That varies because you have some children that have come into the, you have some children that have come into the hospital that are within age and they know what's going on with them. They know their medical situation. Some kids are like, they're more vocal. Now parents, that was one thing that I had to get used to working in pediatric ICU. Parents can be your biggest challenge, but like I said, most of the children that we took care of, they were usually within age and they can voice like, this is what I'm feeling. I am in pain. I don't feel good, stuff like that. I'm really hurting, so in my situation, yes, the kids were more vocal. The parents, they understood things of that nature, but, depending on what's going on with their child, yes, some parents can get very frustrated. And that's understandable. Your child doesn't feel well. Your child is sick. Your child, unfortunately has to go to ICU. They're getting admitted. So we always understood that. And, if it really got too bad, we had a support system. We would have social services, come and talk to the parents, or, a supervisor, if it got too bad, especially if we're in the midst of, taking care of your child and advocating their care and making sure that we can do everything that we need to do to make this better or to make the situation better. So it's a challenge no matter what to me. But yeah, to see a child experience that is really sad because it's like you just want to make them feel better. You want to get rid of what they're going through. You want to get rid of the pain. You want this to go away. I had a young lady, she had been like 15 maybe. She was already in the hospital. She was actually on one of the other units and she ended up having some issues with her blood count. And from what I was told, not sure if it was true, her pain wasn't being managed like it should have been, which caused her, to have more complications to where they could not get it under control. And we had to send her to ICU, which I've seen that more than once.
Yeah, that's sad. That right there kind of pisses me off because the fact they are kids and the fact that if that was to happen, that means the mother probably wasn't educated enough to advocate and go to war for that child. That child don't know. Because I'm gonna tell you something, as a grown man, I done laid in there and had doctors, just nickel and dime me to death. Just more of a metaphor. Just more or less, okay, I take this at home, but you give me less of what I'm taking at home through this pump, this IV pump. So how does that make sense? Like, but you get these kind of doctors, nurses, more or less doctors, like I said, because they're the ones that's writing, and actually prescribing, the medication. Well, imagine as a child dealing with that. I deal with, like I said, as a man, and it's not fun. Like, to the point
Right.
where, you know, that's why it's important for people to learn how to advocate for themselves. It's important to have that
Yes.
support. It's important for
Very.
the caretakers to understand what they're dealing with. Like, a lot of them don't even know. They just sit here and listen to the doctors and nurses and just thank God, you know, that you're not one of them type nurses that, you know, go the other way. You understand because you've been knowing me for a while and you already knew what time it was.
Yes.
You know what I mean? So imagine you get them ones who just hear in class, drugs, 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 drugs. Like, and, you know, I will let you know, because you do get a lot of doctors and nurses try to play God. Well, he don't need this.
Yes, you do. Unfortunately, yes, you
She
do.
don't need that. He don't need it. And they, you know, we all know there's racism in the medical field. We know this to be true. It always been there.
Bad. Okay.
Yeah,
Very,
and I'm gonna tell you something. It probably got worse. Like,
Yeah.
you know what I mean? To be honest, I think it got worse. But we know that they look at Black people as if we got this pain tolerance that's so impeccable that we don't need this medication to get us under control. Like, you know what I mean?
That.
You know, well, speak to that. What you think about that? This force.
Oh Lord, you really, really just touched some real.
Right.
I ain't gonna say that word I really want to say, but you really just touched some stuff there, because you already know what it is. Now I'm really starting to get a little, but that's been a theory for decades and probably centuries. However, that's why I always tell people, like you already said, advocate for yourself.
Yeah.
Don't be that individual that's so quick to believe everything a doctor says, everything a nurse says, everything a pharmacist says. At the end of the day, this is all about the mighty dollar. This is a business.
Yeah. Yeah.
People being sick, medications. This is all affiliated with businesses. Let's be all the way real. You know me.
Yeah. Yeah, indeed.
When it comes to, like, can I step out of subject for just a second?
Yeah.
So, let's speak on this vaccine for this virus.
Right. Right.
I am a nurse, as you already know, and even I won't get it.
Yeah.
I will not. I refuse to get that shot, that vaccine. And I'll explain why. Why on God's green earth will I be so quick to get a vaccine that they just came up with? We have HIV that's still existing. We have AIDS that's still existing. Cancer is still here. And, you know, our country, quote unquote, you know, is still fighting for cancer. We're still, you know, we're fighting and we're raising money, you know, for this awareness, this illness, this awareness, this illness. Where's those cures for that? Right. And these are illnesses that have been around forever, longer than you and I have even been thought of. So where's the vaccines? Where are the cures? Where are the miracles for these? So when you come up with something within a year, okay, I don't believe in that. And you know, I tell people all the time, like, even when I was in nursing school, I know that I'm older. I know that, you know, when you get older, your body starts to lose natural minerals, starts to lose, you know, a lot of things that the body requires.
Right.
Why not strengthen your immune system naturally? What is wrong with that? I will say that this virus has been around more than a year. I'm not counting March of 2020 at all. To be honest, this virus has been around since October of 2019. We just didn't know what it was.
Right. Yeah.
Let's just be real. So I can honestly say I have thankfully not had it. I have not had this, but I've never caught it. And I work around people. I've worked with people who have COVID. I have been a COVID nurse a couple of times. And I get tested twice a week. Negative, 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 negative.
Right.
I mean, come on. I don't understand it. You know, when it comes to medicine, you know, a lot of these doctors, they're, you know, they want you to continue to come back. They want you to continue to take the medicine that they're prescribing you. Like Black patients, not all, but majority of us have been through this. Like in Black women, when it comes to us having children, bearing children, we have the highest mortality rate and
lost a
death
friend last year. Yes.
Because of the care the lack of care that we get.
Yes.
Having a baby and being in a hospital, and it's really sad, but a lot of people will deny it. Oh, that's not true. You can deny it all you want, but it is what it is. We get treated totally different versus anyone else, and people can feel the way about that. That's okay, you're entitled. However, it's what it is.
It's a known fact. It's a known fact, and like I said, this is why I do what I do here, because as a patient, dealing with sickle cell, what caused me to see all these doctors. So I get the bird's eye view. You get the business back end of the bird's eye view. So it's a lot of shit that I just brought up from me looking as a patient that you agree with from looking at as a provider. Like, you see what I'm saying? So it lines up. But, even with the vaccine, because they have been pressing me to get it due to me having sickle cell, I'm not quick to get it. Of course not, because once again, like everything you just said, I don't knock folks who do it, more power to you.
Right, I agree with that too.
It is what it is. But for me, I need to see the results of folks walking around with it for at least a year or two. and then let me see, but like I said, because we all know it's a big business, just like writing prescriptions, doctors get a portion of it. Like I say, what blows me away is how much the insurance company has more say than the actual doctor and nurse. Like, yes. Now that blows me the fucking away. Like, so then even with these drug reps, now they'll come up in there and say, "Oh look, I got these M&Ms and these knockout headaches. If you sell a few of these M&Ms, I give you a third or fourth." You know what I mean? For every script you write. So it's a business, and we understand that this is why people need to learn how to advocate for themselves. They need to get them third opinions. Main thing you need to do is take care of your health. That's right. To the best of your ability, take care of your health, because I'm gonna tell you something. The worst thing in the world is when someone think you need them, they're gonna treat you like shit. Excuse my French, it is what it is. And I see that dealing with doctors. I had an incident where a doctor refused my medication because I have a medical marijuana license. And he told me, if you don't forfeit it, you ain't getting your medication. Knowing that the medical marijuana here where I'm at in Ohio, it's shit so high, you can't buy. It's not like I'm going every in this $5 cheaper than my prescription. Right. The medical marijuana allows me to take less opiates. So why do you have an issue with that? You tell me, oh, your opiate level is such and such. But if I'm telling you that this marijuana helps me take less of that, now you want me to forfeit this. Like, I'm gonna get my weed how I get my weed. That ain't gonna stop that. It is what it is. Right. But I'd rather buy from a location that's more controlled versus how I would have to do without my medical marijuana license. Exactly. In this day and age, they flaking stuff over everything, so you never know what you're getting. In that life. So it's like, okay, y'all know I smoke weed. It's in my medical records. I've been doing it for years. But this guy came in with an S on his chest. He came in. I'm gonna tell you how sickle cell is crazy. What they're doing with sickle cell now, because over the years with me just dealing with it and me educating myself, it's like a lot of kids are taking a lot more medication. They have these 3 different medications, and I can't pronounce all of them, but they only been around within less than 5 years. So it's like, and these kids, and they taking this stuff like man, I have SC. I know people with SS. I understand it's painful, but it's a lot of stuff you can do yourself. You want to cut down the number of the number of prescriptions that you take it. You don't want to take all these different scripts and all they got a side effect to it. Right? So for what I'm hearing now is they want to get away from treating sickle cell patients altogether. They want sickle cell patients to go straight to the emergency room for all his treatments, his or her treatments. But when you come out, there's no follow-up. There's no med Ps. There's no, like I said, there's no follow up. So this is what they get towards these bigger cities. So this is why they forcing out these new medications on sickle cell patients. Like I said, it's really crazy what they really doing to it, because we know that, for example, the doctor that I had to leave, he's a doctor who deal with kids. He never really deal with adults, but he go to Africa and deal with patients over there. Patients in Africa is different from patients over here.
Of course.
So you can't use the same tactics you do over there in the U.S.
Exactly.
But it's so bad that they had to hire this cat pro bono. They're not even paying him. They allow him to run experiments. He said, now this, I can't give it the source up because, it's 100. But the agreement was, you can do your experiments. We just need a doctor. He's there once a week, but he's over dealing with the other kids and being back and forth to Africa. If he's there once a week, he ain't doing no real life treatment.
No.
But you. So what's the experiment? Is you taking people medications, and what is you really doing here? Like, you know what I mean? So I'm asking the question. So for as you dealing with, I would love to see you deal with adult patients, because I know I'm not gonna say it's easier, because it's not, because you're dealing with parents too. So
right.
There's no difference.
But it's still, I'm pretty sure there's still it's still a difference.
Yeah.
Somewhere with that. Yeah.
Yeah. It is.
There's still a difference somewhere.
I would love to see, just to get once you worked around adult patients with sickle cell, just get your comparison from your bird's eye view, because I'm gonna tell you, it's gonna blow you away. Like,
I can only imagine, because I've worked with adults I was a PCA for years.
Okay.
I've been in the medical field since my 20s, and just dealing with the adult world, I didn't get into pediatrics until 2017. So I was always around adults, anyway.
Yeah,
but I also started out in the hospitals. I didn't start out like in retirement homes and facilities and stuff like that, but working in the hospital, working with adults is different. It's definitely different. Like, some people prefer not to work with adults, and I'm like, shoot, to be honest, I feel like it's harder to work with kids. And it's because they're children, they're younger, they really haven't had a chance to, live a partially full life yet. And so when things are going bad with children, and like I said, working in intensive care was, I to be honest, I was afraid I was gonna end up with depression.
Why is that?
Because I saw too much.
Yeah.
I saw way too much working in ICU. When I first started out, I cried a lot. I looked up at God. I never questioned him. I was like, God, like, why? Are you sure? Is this where you really, what I mean? Like, is this where you really want me to be?
Yeah.
I mean, it was a lot. I had a lot of emotions, working with kids. Now, adults, it's different. Adults, especially, certain ages of adults, you still get attached to adults too. Adults, we deal with things differently. Our body, deals with illnesses differently than kids. Kids are more resilient for some reason. They're more resilient than we are. I still don't get why, but they just are.
They are.
So it's a lot. It's a lot. And the thing is, with patients with sickle cell, and you're right, a lot of doctors and some nurses too, have very, 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 excuse my French, fucked up views on patients with certain illnesses, like you just said, sickle cell. That shit is not fair. That's not fair at all, but it does happen, unfortunately. Unfortunately. And I will add this I'll add more salt to the fire. There's too many people in this field that has no business being in it because of that kind of mentality, that kind of attitude, that kind of the spirits that they carry. Like, it's terrible. Nursing, the medical profession is too political for me, to be honest. But this is something that God wanted me to do. Like, I tried to get out of nursing because of this. I'm being I
But
really
you in
did.
it for a reason, though. You in it
I
for a
tried to
reason.
get out of it 6 years ago. I really did, because I'm like, this is too much. This is ugly to me. You know, I don't like it. And when I tried to get away from it, I went to school for something else. Everything bad went, everything went south for me. And I'm like, okay, well, let me try to go back in a few, my son graduates from high school. As soon as he graduated, I went back to college and I went for this, and it was just like everything fell into place. I'm like,
You here for a reason. You in that? I mean, you using it. You in this field for a reason. Like I said, it's just the more. If it ain't just to bring awareness, and you be the one, you be that vessel when you come across them patients, and you know what I mean. Because like I said, all nurses, doctors, not bad. We know this. I mean, I can't. I'd be a fool to say so.
Right.
But this is why I also tell patients too. Like you have. I get it. When you in pain, you a little more edgier.
Of course.
You more temperamental, you more straight, direct, to the point. But at the same time, you got to realize you looking for help too.
Right.
Now you got to control some of that, that snappiness, and because one is not the nurse's, doctor's fault. It's not y'all fault. You know what I mean? Y'all doing the best. So as my mom, my grandma say, what they say, you catch more honey. You know what I mean? Would you catch more flies with honey or some shit like that? I don't know. I remember I said
you catch more flies with shit.
I almost said it. Like, nah. But you see what I'm saying, though? It's like you have to control that, and I get it, because I done flipped out on doctors. I done had doctors, stereotype me to the third degree. I done had nurses call themselves as they was giving me my putting the IV in. I had a nurse grab my arm and squeeze me like first of all, you have no business doing that. But what she didn't realize is that was like massaging me, so it felt good. Like, I was already in pain. Like, you ain't about to do nothing I'm already dealing with right now. Like, you know what I mean? But the fact that I saw her face, it was a white lady. She pushed my hand so hard, like, I'm looking at her like, what's the purpose in that? And then she come to me with these pills in the cup. Didn't see her open it, and then she was wondering why I didn't take it from her. And I told her, I say, one, you just squeezed my hand. You were really trying to inflict harm on me. Like, your attitude is shitty. I don't trust nothing you doing right now. Give me somebody else.
That's right. That's right.
Because your energy is taboo. Like, you know what I mean? I didn't do nothing to you. Like, I done had doctors get mad at me because I got tired of being poked and stuck, and you missed that, and you missed the vein, and I called such and such to come down from uptake flow to come
like IV therapy and stuff like that, or vascular access team. And
I had somebody come from IV therapy, and they was salty to the emergency room to access me. Y'all stuck me for what? And at that time it was like 7 times.
Oh my God.
3 strikes, you out. 7 times, you just, now you just probing, now you testing.
Now you just poking me. Yeah. Who wants that? Like, who wants that? If it was them, they wouldn't allow that. I'm pretty sure.
Exactly. But you do see, like, you feel it. You feel the shift in the medical field. It was always some shit. It was always some stuff in the game, but me as a patient, I see it and I feel it. Like, I feel, even when you go, now when you got a doctor's appointment, they do it like this, Zoom. Some of them. You can't treat me through a camera.
Right.
You have me check my own blood pressure. What if my batteries ain't running good in my blood pressure cuff? And you got
what if you got the wrong blood pressure cuff? Like, every blood pressure cuff isn't that good. Like the ones for the wrist. I hate those. Right. I hate the ones for the wrist. A lot of people's like, well, get you a wrist one. No. I'm not doing that. They're not even accurate.
Right.
So
but that's the treatment now. Then they give you, can you put a thermometer in your mouth? Jump on one leg. Like, let me see. Then now you out in the camera voguing with a motherfucker, like, you know what I mean? Now, like I said, so the treatment is like, that's not treating me.
No.
And then you bill me as if I was in the office with you. All right. So it's crazy. Because to see it now, I don't know what's going on in the medical field now. But once again, I try my best to take care of myself. I will encourage anyone else to do so. If you can shorten your stays and your stints in these hospitals and You know, make sure you don't become a full-time patient as a sickle cell patient. Because I do see a lot of us that's full-time patients that all they do is go to the hospital for everything. Like, try something first. Like, because I'm going to tell you something. That day going to, I mean, you know, I always said, knock on wood, I would hate for the day for somebody really have to treat me. Because now when you go to the hospital, all they do is weigh that thing in your face, they check your temperature, and you're out of there. Right? There's nothing really going on. Right? But
now, you know me, I can sit up here and tell everything that I take.
Right.
Yeah, every single day. Me, vitamin D3, like when COVID really reared its ugly head last March, the first thing I kept saying, vitamin D3, vitamin D and vitamin D3 are two different supplements. You can combine them, but they are not exactly the same. Vitamin D3 is more for the immune system, more for your respiratory health, more, you know, for lung health. Vitamin C, I take 1,000 milligrams every day. Sea moss. Sea moss is one of the main keys. Sea moss will excel. It accelerates your immune system.
Yeah.
Black seed oil.
Yes.
I take 2 of those every day.
Yeah.
My son, he's 20, takes this every day.
Yeah.
By the grace of God, neither one of us has had this. And like I tell people, you know, vitamins, minerals, your body needs minerals, you know. Study your body, listen to your body. Like I can tell when I have an iron deficiency. I can tell when I have a vitamin D deficiency. I can tell if I had a vitamin B deficiency. Like as a woman, I can tell all of these things. Yeah. Because now, you know, the older I get, the more in tune I'm getting with my body, the more I listen to it. Like a few years ago, I had an iron deficiency. My hair stopped growing. And I peeped it. I'm like, wait a minute. Because I always had really bad dandruff. I used to get treatments and they didn't work. I didn't have any. And I thought that was weird. I was like, wait a minute. What's going on? Something told me, start taking iron again. So I did do that. And next thing you know, my hair started growing back. Because with iron carries oxygen. Yeah. To your hair follicles and stuff. So I had to get myself together. I mean, it's just amazing what the body, you know, the body is an amazing thing. It really is. It really is. It's just awesome if you really just, you know, listen to it. You learn more about yourself. And, you know, us as African Americans, you know, we have to do things differently than what other, you know, cultures. I don't have nothing against nobody else, but I'm speaking on us right now. We have to do our bodies. We have to treat our bodies a certain way. We have to put certain things in our body that, you know, what other people might put in their bodies might be something that we cannot put in our bodies. Like, for instance, well, not speaking on that, but the sun, you know, for, you know, Caucasian people, the sun is not their friend. No. It's our medicine. Yeah. It's our medicine. And people like Bill Gates knows this because that's why he's trying to block it. Yeah. That's the subject for another day, though. Yeah, that's a different, that's the subject for a different day. But I know what you're talking about, though. I know exactly what you're talking about. You gotta say that. So that's why I say, you know, be your own advocate. Yeah, you got to. When it comes to health. Yes, always. You got to. Always. And this is why, like I say, this is why, you know, I've been doing this for quite some time. And, you know, that's why I say, you know, even just getting you on to come on and chop it up. Because I know, I mean, I know what field you in, and I know how long you've been there. It's just, you know, a lot of patients don't know how to do this. That they don't know how to advocate. They don't know how to communicate. You know what I mean? You know, a lot of the parents, like, oh man, the parent when they got these kids, having these kids with sickle cell, and they don't have a clue on how to treat them. Like, they should link up. I mean, if it's not 365 Never Ending Fight, another organization, somebody that's gonna give you the knowledge on treating your baby. Right. Because you got to prepare your baby for that transition from childhood to adulthood care. And that's a beast. Yes. Two different things. Because like how you say, you know, when you're dealing with the kids with sickle cell, like y'all more attentive. Like, you know, as I mean, as caregivers and I mean, to kids, you can't help to be more hands-on, more attentive to a child in need. Once that child hit 18, 19, and he cross the street, go up to burn it, and cross the other side,
You a number now. They're gonna let you sit out there. If you don't, I done learned so many ways to get up through the line when I go to the emergency room. I done learned so many tactics and things, and I know what to say to get me not sitting out in the lobby for 8 hours, 10 hours in full blown crisis. And they and they label you one between, what is it, 1 in 5 or some shit. They put a number to your severity of how fast you need to get to the back, and they put a number on it. They put that wrong number. You can be sitting out there 10 hours, easy.
True.
Full blown crisis. And we know that the longer you're in the crisis, one, the harder it is to control, and the deadlier it is.
Yes, it is.
Because you clotting. The blood is not flowing. All it takes is to run wrong spot. But like you said, but for the body wants to heal itself. I'm gonna tell you, I wear this sleeve, and I had a port pull years ago, and it launched a clot, and it, did a whole thing to me, right? So now I have to wear this sleeve. But your body wants to heal this. So what my body started doing, my body started making these other avenues to drain the blood from my chest back to my heart, right? And you can see it pop up on you. It's amazing, right? I remember I went to go see the vascular surgeon, and she was explaining this to me. I was crying and laughing at the same time, like, it was, because I was so amazed on how your body wants to survive. Your body wants to survive. Your body wants to heal itself. You just got to assist it and provide it the tools, which is through medicine and things like that, and food. Natural things. Like I said, that's what but a lot of people don't understand that part of it. It's a whole beast. But that's why, even for my logo, that's why I have the boxing glove 365 never in a fight, because it's an ongoing battle to be productive and to be healthy. This is not a once every other day thing. This is every day, all day thing. Because if it's not there, if you ain't gonna do it, them folks over at the hospital, they're gonna play with you.
They damn sure ain't gonna do it.
They're gonna play with you. They're gonna experiment with you. They're gonna do all these things. So but like I said, for you with the school and you being in school and how things, a lot of kids don't like. A lot of people that's graduated don't know how to treat sickle cell patients. I would love to have nurses go back in with a patient and talk to that up and coming class that's coming out. Somebody who already been in the field and learned that shit and peeped it. Because it is different from reading and being hands-on.
It's totally different.
It's night and day. Right. And I get that. But I would recommend for them to step it up for the information inside them books. If they don't, that's what this is about. Just to spread as much information, bring people on who know the field, such as yourself, and get your point of view on things, on how things should go. I would love to do that. I would love to bring you onto a panel and speak to some of the more nurses that's coming out.
I would gladly do that. Just give me a day. Make sure I'm not working.
Oh, for sure. You already know.
I could definitely do that.
I'm gonna give you a heads up because I think it's crucial. Like I said, because I try to, go back in and talk and link up with them and discuss different things about how sickle cell patients. Because like I said, I would love to see it get to where we treat it fairly, just on the same page as diabetes and cancer. And
yes.
But right now it's a taboo. It's been a taboo for quite some time. But it's going to take us patients to change that. It's going to take our people, Black people. Because right now, cancer, you hear cancer? Because cancer affects more a variety of people. Let's put it like that. So we know that. But right now they say sickle cell is no money in sickle cell. This is why they try to wipe out sickle cell clinics. Because there's no money. And so most sickle cell, on Social Security, Medicaid, Medicare, different things like that. Some of them don't pay at least what they think. Some of them don't pay their bills and different things like that, which is not the case.
Right, of course.
But, there's no money in sickle cell. We know it. And this is why we struggle to get the attention that we need, so.
And that's really fucked up, because the thing is, sickle cell, that's really, I can only imagine everything, you know, that you deal with on a daily basis. I remember, you know, back in the day, I watched you go through a lot even then. And it broke my heart. And I was just like, oh my God. Sorry. I mean, I don't understand it, but you know, like that's why I do so much research on natural things and, you know, looking up this, I'm researching that. And, you know, I'm just like, well, you know, instead of, you know, trying this, you know, look into this. Like, I follow, and a lot of people don't believe in this, you know, this man's, oh my God, sorry, believed in this man's method. He's no longer with us, but Dr. Sebi, I'm a big believer in,
Oh yeah.
you know,
Indeed,
everything that he stood by and believed in and everything he's done. And now his grandson is trying to, well, not trying to, he's actually, you know, keeping his legacy going. And I just, you know, I've interacted with him before, and I mean, he's a smart young man. I give him his credit, you know, and Dr. Sebi's wife, you know, I follow her too. And, you know, it's amazing what this man has done, and you know, and it's really messed up why his life was taken.
Oh yeah. Best believe it was.
You know,
He was fucking up. He was fucking up their profit.
You know, like I tell people, the biggest threat to America is a powerful black man.
And a woman, indeed.
Yeah,
that's why it's organized. You know, that's why
the
system don't sleep.
We're a threat. We're a threat. The more we know, the more of a threat we are, apparently. Yeah. So, I mean, it's really messed up that it's like this, but it's like this.
Yeah, but it takes us, it takes information. It takes us to, you know, support each other. Like I said, you know, I mean, like I said, it's a system that doesn't sleep while we sleeping. They working on the next thing, you know, but, you know, this is why it takes us to, you know, to take care of us. You know what I mean? Like I said, you know, for the ones, you know, educate, school, I mean, chop it up, pull somebody coattail, whatever metaphor you want to throw out for education, right? You know what I mean? So, you know, but we already know that because, you know, Dr. Sebi, he beat the case in the courts where he proven he cured AIDS, sickle cell.
Killed 13 people with AIDS. He cured, you know, patients with sickle cell. Like,
I've been chasing that remedy. When I first heard him, I've been chasing that remedy. I didn't talk to his wife, his son. Yeah, I mean, you know, they charge for their knowledge and what they supposed to.
Yeah, they do.
What they supposed to, but you know, some of the things I was able to afford. The other thing was just research. I looked the rest of it up, like just point me in the right direction. Yeah, that's all I asked you, like, and you know, which it was beautiful to talk to them that brief time I did speak to them over the phone. But I have been chasing his remedy for quite some time, and a lot of things that I implemented from him has helped, you know, cut down on my episodes, cut down, you know, I do the black seed oil, I do, you know, zinc and magnesium and vitamin D3 and B12s and sea moss and elderberry and turmeric, ginger. And you see that
turmeric, the truth. Woo!
I even tap into the stones and light therapy and frequency hertz. And so a lot of things I tap into is not just a Percocet or Oxycontin.
Right,
it's not just a narcotic, it's deeper than that. Like much deeper than that.
Music therapy, you know, you got that.
The whole nine. Right? Because even with depression, I deal with depression. You know, sickle cell, sickle cell was pain, but it's also mental. So it also can affect you, you know, your depression, your anxiety, and things like that. So it's different things that I had to implement for as a therapy dog. My dog Loyalty. That's what he is. He's a therapy dog because he
I kind of sense that. I sensed that, and I never said anything, but and that crossed my mind when I saw him on your page, and I was like, I bet, you know, his dog.
I'm gonna tell you something. When I first started dealing with anxiety, the shit it hit me left field. Like I never experienced. But when I couldn't work out no more due to this, and I couldn't lift weights no more, and I had to get rid of all my weights and I didn't realize how often that I walked past them weights and picked them up all through the day because that's me relieving stress and anxiety of me not even knowing this is what I'm doing. I just picked them up and went and do it all day, every day. So when I couldn't lift weights no more and everything started to sit in health-wise, then my anxiety, I wasn't relieving that through working out no more, so it kicked in. And they tried to put me on a whole bunch of medication. I said, well, let me try some things first because it ain't that serious yet. And one thing, my son was like, Daddy, get you a dog. I always loved dogs. I grew up with dogs. But I'm like, yeah. And all it did was, it took me to, because it allows me to take care of something besides myself. A distraction, basically. Like, you know what I mean? And, you know, hey, that's why I call him loyalty. Like, that's my guy. So it works. I'm going to tell you.
Dogs are very therapeutic, believe it or not.
Yeah. And they know.
Very therapeutic.
They know what time it is.
Yeah.
They know what time it is.
Dogs are very smart. They really, really are. And, you know, I recommend people, that's why I say, you know, try natural routes. Like, you know, a lot of people don't think, you know, well, when some people, they're like, oh, I have cancer, let me go run the chemotherapy. There's a cure. My grandmother was a nurse. Okay. So I basically followed her footsteps. There's a cure for everything. That's something I've always believed. Magic Johnson's still here, damn it. So it's a cure for everything. I mean, let's go there. So to me, there's a cure for everything. My grandmother, when she was alive and before she became ill, she was very intelligent, and I'm very underestimated. Like, this woman was, in my eyes, she was brilliant.
Yeah.
I mean, she knew everything that's happening now in this world. My grandmother had already warned me about when I was a child. She was like, baby, there's going to be a time you're going to have to grow your own food. I was like, oh my God. Yeah. She wasn't lying, you know, all these diseases, that's how, you know, I mean, she was just, oh my God. I was like, I don't know if she think I wasn't listening to her, but, you know, I was listening. And, you know, looking back on everything that she told me, I was like, shit, she was right about everything.
Real.
It's deep.
Yeah.
It's deep. I was like, oh, like it just hit me. It punched me in the face dang near. I was like, oh my gosh, she was right.
Yeah.
But, you know, that's why I do, like, I'm more into natural stuff. You know, my grandmother gave me a book on remedies. I wish I could find it. I don't know what happened to it.
I remember my old school books back in the day.
Yes, I mean, everything in there worked. Because anytime something happened with us, she did it. You know what I'm saying? So, I mean, Granny kept us out of the hospital. Granny kept us, I mean, like I said, she was a nurse herself. Like, we barely got sick as kids.
Yeah.
Barely. We would get a spoon of that nasty cod liver oil. Never just.
All right, but you know, medication comes from the earth, right? Every medication starts off a natural.
It starts off.
It's just when they mass produce it and put that dollar on it and figured out all the other elements.
Yes.
That can, you know, this may have cannabinoids, THC or the other one. You know what I mean? But they also now they got A, B, C, D in it now. You know what I mean? And that's more or less, it might make it last long like they do the food, preservatives, for longer shelf life. Because I think something else just came out on the news recently about something that's in the food that we've been eating for years. Like, a lot of cereals got a lot of different things in it, like all them.
Yes.
You know, like I said, we can go all day for the food. That's another beast. But yeah,
I stopped buying cereal because of that. I was like, what? I ain't ate cereal in years.
I ain't ate cereal and I missed my cinnamon toast crunch.
It's awful, but you know what? But they knew what they were doing. They knew that shit was in there. I don't know why it's coming out now, but that's fine. However, you already knew about it.
The damage is done.
You know, is this your tactic to get people, to push people towards something else that you're I call it tampering. So you're right. Everything comes from the earth. Everything that heals us comes from the earth. It's just that when these people, these consumers, they get their hands on it, they tamper with it, they contaminate it, they tarnish it. You know what I'm saying? You're adding, you know, synthesize or whatever, you know, whatever other extra stuff that you're adding to it. And that's the problem. Like, that's why I'm gonna tell you this. So cancer, best thing for cancer, B17. B17, sea moss, black seed oil. But the FDA banned B17.
Wow.
Why is that? Because if you are taking a natural route, you're taking money out of their pockets.
Indeed. Indeed. And that's why Dr. Stevies no longer around.
Yeah.
Because when Dr. Sebi was killed, actually it was a few more that got killed at the same time, them in the same time, but that they don't even speak about those names. Like, you know what I mean? He's just the more popular one that we speak of. But but like I say, just educate one another, motivate one another, support. That's what we need to do. That's what everything I do here at 365. That's what all my events that I throw, like from the sipping presses to, through the Gators and Heels, everything I do for sickle cell and mental health, because I understand, of course, because I walk into life every day, all day. Even the blood drives, all the blood drives are out coordinated, because I understand SS, that's a means of their treatment. And it's not just for sickle cell patients when I do these blood drives. It's just I'm doing it up under sickle cell. It's anybody who needs this blood. You see what I'm saying? And our people is one of the hardest people to get to donate. And what they need to understand about the sickle cell is, like, for example, my body is less likely to neglect or reject your blood because we share the same, gene. Like, it's being black. So that's what a lot of black people don't understand from sickle cell patients. Not saying that a white person blood or Mexican blood would not save our life too. I'm not saying that.
I know.
More black people need to understand that we need each other, like no other. Like, we heal from each other.
Of course.
That's it. So, but this is why I do the blood drives. I used to work for Oxford for years doing it.
I remember that.
I've been known for Oxford for years and I still do it. Like, I don't get paid for this. Like, it's not about the money. I just know I have too many friends that receive blood transfusions on the regular. I have one friend right now, she almost on her 300th donation transfusion. That means that she needs blood to do simple things in life. To go to school, to go to work, to be a friend, to be a spouse, to be a daughter. Like, they don't understand what that takes because, one, we don't talk about it. We're not going to tell you that I just received a blood donation. This is how I was able to come to your birthday party.
Right.
This is how I was able to attend your wedding because somebody gave me blood. I'm not going to tell you that, but that's how I got here. That's how you were able to enjoy me at your festivities because somebody donated blood. And it came in handy. When somebody working on a 300 transfusion, that means that they need blood really to survive and live some type of a productive regular lifestyle. So this is why I do the blood drives as well. So, like I said, this is everything we do for sickle cell and mental health. We just have to support each other. That's all. There's more support, we'd be all right. Until that day.
Oh, of course. It's just a matter of us coming together. That's the hardest part.
Yeah.
That's the hardest part, is us coming together. And it's just like it shouldn't be this way, but you and I both know, what that's like and what that's about, and stuff like that. It's just I tell you, when you're trying to spread education, when you're trying to spread knowledge, you and I both know how slim, the outcome of that, and, actually getting people to, really pay attention, to really listen. It is very slim, unfortunately.
Yeah, it is. It is. It's sad with us, with our people. We thinking that if I donate, I'm putting money into his pocket. That's not the case.
No.
Like, that's not the case. This is why you do your research. This is why you do. I have people do, a reference. Like, do you ever heard of 365 Never in a Fight? You ever heard of this guy, D'Angelo? And they're like, oh, yeah, he's been doing it for some years. Like, he's been doing it for quite some time. And that's what you got to do to support, so be it. Like, you ain't hurting my feelings. Like, but, just support more. So, like I said, but we're going to wrap this up, babe. I want to appreciate you for taking this time out with me.
Oh, anytime. That's why I made sure I didn't work today. I really didn't feel like going anyway. I pretty much work when I want to. I don't work full time or part time. I graduated and was like, you know what? I know stress. I know nursing is stressful right now. I'm not killing myself fresh out. I'm getting my vitamins together now.
Hey, I'm about to get mine. I got them in my pocket. Yeah, I got my vitamin D3. I gotta take 2 of them. They say my vitamin D level is pretty low. You know.
Well, you know that's common with us. You know that.
You know what? And I also hear it's hard to even judge with us about our vitamin vitamin D levels. Like, you know what I mean, it's kind of hard because our bodies soak up. You know what I mean? So much, you know, the sun. Like, you know what I mean, because I'm gonna tell you something. For the longest, I stopped taking it because I wasn't sure. Like, you know, I wasn't sure if it was really working. Like, then after I got back on it, then I could tell. You know, but I take that zinc, magnesium, a lot of different things, folic acid.
Folic acid, yes, that's a must.
Yeah. So, you know, like I said, you know, I take a lot of different stuff, and I eat. My diet is something changed drastically, like, you know what I mean, which I'm happy about that. You know, I had to change my diet from back in the day. You know, they say eat the lid, not lid to eat. You know what I mean?
Pretty much.
I'm gonna tell you, that's why I hate to see. I see somebody just on some real live pig out stuff. I just look at them like, you know, love yourself. Like, baby, push back. No, like, don't. You know, I don't want to get sidetracked on the 600-pound TV show though, but
right.
I have an attitude that, like, did you just eat out?
Mad as hell. Dude, I was mad at myself. Like, when I was in school, I didn't have time to work out because the school I went to, my program was completely accelerated.
Okay.
All I had time to do was go to school, work, maintain my house, go to school, work, maintain my house. I had to schedule everything else. Like, it was hard. So that's why when the dust finally settled, I'm like, okay. I'm like, Candace, this weight has to go. So I started walking 4 miles.
Yeah.
Because I've got some medical stuff going on with me that I just found out about, you know, last month. I'm like, okay, what can I do in this situation, you know, until I, you know, go to the doctor in a week and a half or whatever and figure out, you know, what we're going to do about this. And I'm like, well, until then, you know, I can at least walk, you know, and do 4 miles a day. I was wiped out at first, but I have to keep doing it. So, you know, so I'm like, I'll build my endurance and I'll keep going, this is that. Yeah. But, you know, at my age, you know, I'm 40 now. So I'm like, I really gotta be careful, you know. We're not in our 20s no more.
Nah, I'm 42. Those were the days.
Man.
Those were the days. Look, shit, my son be 23 in July. So
Jesus.
You know, time fly like, hey, time
He'll be 23.
He'll be 23 in July.
They'll be 21 in August. It's crazy.
They get up on you quick, but it's a beautiful thing, though, to see them grow. So, you know, it's I wouldn't change it for the world. It's beautiful. I embrace it. I just realized I'll be 45 in a couple of years. Like,
you don't even look 44. I didn't know you were that much older.
Yeah, I'm 42. Yeah, I'm 42. I don't look 42.
No.
That's that sickle cell.
Shut up.
That's that sickle cell, man. You gotta say that. Keep you young. He said he's a baby. But we're gonna get up out of here. But once again, you got any last remarks you want to leave with the people?
Just be your biggest advocate for your life, your health, your loved ones. Never steer away from that. Also, always continue to educate yourselves on, everything that's going on in this world. Like, even though I'm a nurse now, I'm going back to school in a few months to further my education, because there's more, that I would like to know. There's more, I just feel like God is telling me, keep going, keep going, keep going, keep going. So that's what I'm doing. I know I just got out not too long ago, and I'm going right back to be tortured, but it's okay.
Ain't no wrong with it. Soak it up. Soak it up. You got a vision.
But take care of yourselves. Watch all this stuff. They've been tampering with our food for years, but it's getting worse. Stay away from certain things. Like I don't even eat beef anymore. Like I stopped fooling with that. Dairy is my Achilles heel right now, so I'm working on it.
Yeah, you gotta get that together. That's the only thing.
Yeah, I know dairy is bad. I trust me, I know, but I'm working on it. But I won't hold you. And if you ever want me back on here, I'm more than happy.
Yeah, we're gonna do it again. But like I said, once again, this is 365 N.E.F. Health Talk. Before I get out of here, like just to piggyback on what you said, we do encourage everyone to become an advocate for themselves. That's what this platform is about. So if you want to come up and speak about whatever health issue or whatever information you have about the medical field, this is what this platform is about. This is all we speak on. There's nothing but health, because from mental health to physical health, mind, body, and soul. So once again, if you want to donate, Cash App 365 N.E.F. Foundation. And if you see a 365 event, support it. We got one coming up May 21st, which is the Gators and Heels. I spelled heels, HEALZ, for like healing, not just the heels, regular heels when they walk on. It's kind of get a little crazy. Actually, I did it on an accident. Actually, I was like misspelled it, but it fit the whole.
That's actually dope.
Yeah. I mean, I did it subconsciously, not even realizing that I did it until I'm like, oh, okay. But it runs with it because everything we do healing. So it made sense. It was something I meant to do. Didn't know I did it, but I did it. But like I said, go to 365neverendingfight.com for more information about that event coming up. So, all right, Candace, baby, I appreciate you.
No problem.
In a minute.
Okay, thank you.
You're welcome, baby. Easy. All right.
You too. Bye. Oh, shit.